At this year, 2019 ASH, we got to hear about some long-term data from the Myeloma XI UK study. This was a study that enrolled over 1,900 patients and patients who had lenalidomide maintenance. The specific question being looked at was, with continuous suppression of the myeloma clone with IMiD maintenance, is there a chance that when patients relapse, they would relapse in a more aggressive form? So this study had this long-term 47-month follow-up data and specifically looked at patients from the time they began to show biochemical relapse to the time they actually went onto therapy. And that would be an indication if people were on lenalidomide maintenance had a more aggressive relapse, they would go on to therapy much quicker. So the results of this Myeloma XI study with these patients first demonstrated that PFS was superior for patients receiving lenalidomide maintenance, as confirmed in other studies. What they found, however, also was that the time from biochemical relapse to actually going on to therapy was no different for patients receiving lenalidomide as to those who hadn't. And so the conclusions of this study were there was really no evidence that patients on lenalidomide maintenance were having a more aggressive relapse. Right now in Canada, lenalidomide maintenance is faithfully used. And I think this study with this long-term data supports that it's the correct thing to do and is not leading to enhanced mutations or more aggressive myeloma down the road. So I think there are still a few patients where we wonder which is the best maintenance to use, whether a PI-based maintenance may be useful for patients with high-risk disease. But I think, again, the benefits of lenalidomide maintenance have been shown in several studies now, and this one just further supports the fact that it's the proper clinical practice.